Before we start, if anyone of you has any questions or any confusions regarding, NAC OSCE, you can ask me, and I'll be more than happy to answer. Okay. So today, we will be doing a case on gender dysphoria. Some of the topics are a bit hard when it comes to NAC OSCE. So high yield management topics. So high yield, like all your main systems that you have, like cardio, GI, musculoskeletal, rheumatology, gynae obs, pediatrics, all the systems they are high yield. The only thing which is different from QE1 in NACOSCI is that QE1 is like more targeted on uh, you know, uh, your skills of how to diagnose a case really well. But NACOSCI is more focused on how you approach that case. So in NACOSCI, it is basically a test of your soft skills. It is basically a test of, things that we usually lack as physicians. We are not trained that way when it comes to our, medical backgrounds. So this is something that they really want us to work on our ethics, the way we treat the patient, the way we talk to the patient, our soft skills, body language, all those things are being judged by NACOSCI. Usually in NACOSCI, they ask you for a differential diagnosis. In certain instances, when it's a very clear diagnosis, they will ask you for that. And the other thing which is different from QE1 is that NACOSCI does not have any, rare things or syndromes because it's not something that needs test your diagnostic skills. It is something that tests your approach towards the patient, that how are you going to talk to the patient and how you address their concerns and how empathetic you are as a doctor or as a physician. If you know the correct guidelines when it comes to the Canadian guidelines, that if it's a child, what you need to do, if it's an adult, what you need to do, if it's a case of abuse, what you need to do. So basically, all these things are there that test your knowledge when it comes to NACOSCI. So all the high yield topics they didn't ask for clinical skills. So, what do you mean by a clinical skills, doctor? If you can kindly elaborate more on that, like you mean your clinical skills of physical examination? Is that what you are trying to ask? Yes, no, no, clinical exam is a part of NACOSCI. Of course, you will get a lot of cases with clinical exam, and the way you have, yes, physical exam is a big part of NACOSCI. Like you have to do it. So abdominal examination, your neuro examination, then musculoskeletal examination. These are some of the examinations that respirology, all these examinations are the ones that you need to know. Okay, sorry, there's one more question. What do they usually ask in post and counter questions other than differential diagnosis and management? And can they ask for different criterias and side effect of drugs, for example? As far as hammer is concerned, I will answer all these questions one by one. So as far as hammer is concerned, um, I don't think so. You have to take it. There are guidelines from once your exam is, you are quite near to your exam, like I think 15 days or a month before the exam, you get an email from MCC in which they have mentioned everything, that what you need to bring and what not. So basically we did not have to take our own hammer or anything. Only the stethoscope is something that you need to have. And I will just address all the questions one by one. So first I will be answering for this hammer. So yeah, and usually in NACOSCA scenario, it's usually they don't ask you to do use the hammer and do the reflex, because there are hundreds of students appearing in one day. And just imagine that patient being tested multiple times with the hammer and being checked for reflexes. So that is not something very practical. So usually, but you should be knowing how to do the reflex. You should know how to position the patient for the reflex. And usually they provide these things, but before your exam, like 10 days, 15 days, when you will get your roll number slip and your color code, I think, or your starting station, that is mentioned on the roll number slip. So once you will get that, it is mentioned in that what should your dress be like, and what you should be wearing that day, and what is allowed and what is not allowed. So it has a detailed description of all those things. And if you have any questions, you can always go in the chat section of MCC on the website, and you can ask them. They are usually helpful, and they respond immediately in their working hours, of course. Okay. The other question was, so the clinical exam. Yes, so the clinical exam, you need to know. You will not be asked to do any pelvic or breast examinations, but you should know that what you're looking for, and you have to mention that. Same goes for DRE. So after completing your abdominal exam, you have to tell the examiner that I would like to complete my abdominal examination by performing a DRE. And if the examiner gives you a finding, or you have to tell, for example, if it's a case of PID, pelvic inflammatory disease, so you will tell the examiner that after the abdominal examination, I would like to proceed with the pelvic examination and bimanual examination, and I'm looking for adnexal tenderness. So this is something that you have to tell them. So whatever you are examining, you have to verbalize that. When it comes to abdominal examination, for example, so just go for example, if you feel that the patient has appendicitis, so in that case, go for the specialized tests that you have for the appendix. And for example, you can tell the examiner that I'm looking for tenderness at McBurney's point, and you should know how to locate the McBurney's point and where it is. You don't have to explain that I am measuring from here and here and from the superior iliac crest and all those things. No, but you should know how to do that. And similarly, for example, if it's a case of carpal tunnel syndrome, so you should know what tests to do, and just add one. For example, the students who study with me in my regular batch, I always tell them that do like one or two tests that will confirm your diagnosis, and if you have time, do one more test to rule out the diagnosis. So for example, in carpal tunnel syndrome, also go for the Finkelstein's test, or and just to rule out de Quervain's radiculopathy. So all those things, you should, sorry, de Quervain's tenosynovitis. So just to rule that out, you should do one extra test if you have time. um, okay, so as far as the post encounter questions are concerned, so they usually ask it can be variable. For example, they can give you a list. For example, an ECG. They can give you an X-ray to interpret. Then they can ask you for a list of differential, and maybe you tell the differential. They will give you the X-ray, and they will ask you, okay, what is your final diagnosis now after looking at the X-ray or looking at the ECG. And after that, they can ask you investigations and management of the patient. So they won't really ask you the side effects of the drugs or stuff like that. But in the history taking, you should be knowing that if, for example, if you are prescribing a patient on methotrexate, for the arthritis, you should know that methotrexate, affects kidneys and liver. So you need to ask in the history that do you have any previous, disease related to ongoing disease related to your kidneys or liver, and whatever. And if you forget to ask those questions during your history taking, then it's better that you address them in the management. During the management plan of the patient, management means everything that you will do for that patient. So it will include your long-term management, your short-term management, lifestyle modifications. So all those things would be a part of your management. So this is how the post encounter can be. They won't be asking you for side effects of drugs, of course, but you can have scenarios where the patient might present you with the side effect of the drug, and that can be the presenting complaint of that patient. So you should be, knowing, for example, a patient with acute asthma exacerbation, that patient can present, and when you take the drug history, you will find that he might have used aspirin for something, or anything that could have triggered that. So this is how you should know the drugs. You should know their the main drugs, not everything. For example, anti-tuberculous drugs, you should know what are their side effects, and what systems to screen if you're starting a patient on anti-tuberculous regime. So what you need to screen in that patient, what you need to know. Okay. Any other questions? Okay, and we should know what we will find. Like if there is abdominal pain, we will discuss all differential diagnosis. Yes. So if it's an abdominal, I don't know, Anna, when your exam is, but if your exam is in like in September, then I will for the September students, I will be doing a free. Usually, I let the students, appear in my first batch, first class. Usually it's GI, so you will know what to do. But if it's right now in May, then for that, yes, if the patient is there with abdominal pain, you have to see the quadrant of the pain where the pain is, and then according to that you have to narrow down your list of differentials, because abdominal pain is such a big topic. If you will not organize it properly in quadrant wise manner, you will be lost in the station. So you need to know which quadrant the pain is when you start the pain questions like PQRST. So after the location of the pain, narrow down your diagnosis and then build your history on that, whatever your diagnosis can be. And yes, you have to tell the examiner that what signs, what test are you doing and why are you doing that. So for example, if you're performing the Murphy's sign, you should know that what are you looking for, inflamed gallbladder or not. So you should tell the examiner that I'm doing this particular test, or SWAS sign. If you're doing that, you should know what are you looking for. Okay. Uh, any other questions? Let me go back in the chat. Okay, so I think I have answered all the questions. If there is anything that I have missed, please do let me know, and then we can start the session. Any other questions or clarifications? Okay. So just one tip for NACOSCI, that go with an open mind. You will be familiar with all the topics that are there. If you have taken, any classes or any courses or whatever, wherever you're studying from, so you will be familiar with everything which is there. It is just the way that the SP can ask you questions that can twist things a bit here and there. But the thing is that you should know how to deal with that situation as well, that if you are not familiar how to answer a question, or if you don't have knowledge on um, that topic, then you should know how you will be managing that as well in NACOSCI, just like the way you will do it in your real life. That if you see anyone, sorry, I was admitting a few people. And yeah, I think, is that all? Any other questions before we proceed? Okay. So today's class is on gender dysphoria, and I was getting a lot of messages from some of the students, and it was a long overdue class because you're welcome, dear. And sorry, there's one more question. If someone, example, wife worried about her husband behavior, is it ethical able to take history from wife about her husband's uh, concern? Okay, so the thing is that if the wife is worried about her husband's behavior, so the thing is there is a way to deal with such stations. And the thing is that you will ask the wife that what are you, start with an open-ended question that, what are you worried about? What makes you concerned about his behavior? And it is a possibility that, that is a case of abuse, domestic abuse, which is there. So, and if in that station, if the wife is asking you for some particular information that brings a breach in, confidentiality of the husband, then you will not be answering those answers. You will be telling the wife that right now I'm more concerned about you, and I want to know that what's going on with you. How are you coping up with the? It is hard to see that your husband is behaving that way or whatever it is. How are you coping up with that? So build on that history. And if she says that I just want to know that my husband was here with you yesterday. He's a patient as well, and did he ask you for this medication or this specific thing? Then you will not be answering those questions. You will tell her that I really appreciate that you're concerned in this regard and you want to have this information about the husband, but I would like to see him first and I cannot disclose this without his permission. So even if the wife is there and she is asking you questions, you have to treat it very amicably. You have to tell her that you are here to support and help, and if there is any problem that she is going through, you have to address that. And regarding husband's information, no, you cannot breach the confidentiality. So you will not give her any information. You will request her to bring the husband, and you would like to see the husband in person. So this is how you will be dealing with such a scenario. Okay. Any other question? Okay. So, any one of you who would like to volunteer for the case? Come on, you're so close to your exam. Excellent. So we have a volunteer, Precious. Okay. So I will be moving the screen forward. And if you guys have any questions, you can write that in the chat box. And at the end of the session, I would be more than happy to address that. Okay. So this is your practice scenario that you're a family physician in a clinic, and Ethan Roberts is a 15-year-old, has come in for a consultation with some concerns. Take a focus history and counsel him in the next 11 minutes. So I will be putting on the timer for 1 minute and 15 seconds for you to write your template. And in the exam, you usually have, like they say, you have 2 minutes outside the door, but when you're practicing, I would say that please practice for 1 minute and 15 seconds maximum, because in the exam you won't like a lot of seconds are wasted when you're running from one door to the other door, and then you are reorganizing your thought process. And so once you read the scenario, after that take 1.5 minutes to write your basic template and your task, whatever you have to do, and inside the room, sorry. Okay. And just to let you guys know that I'm recording this session for educational purposes. And usually I, put these free videos on my YouTube channel as well, so that you can have an access to them if you need to practice later on. Just let me know whenever you're ready.
Could you please send in the chat your YouTube channel link? Thanks.
Yes, I will be posting that at the end of the session. And if are you on my main Telegram channel? If you're there, I will be posting the video there as well. So it has some of the other free classes as well that I did earlier.
Thank you so much.
Yeah. So
Is the
Precious, let me
time
know
up?
when. Yes, your time is up. You turn on the camera.
Okay.
Just 1 second. There is
Sorry.
yes, I will post Telegram and both in the chat box. Okay, after this scenario is done. Okay, so we can start it now. Please go ahead.
Okay. Knock, knock. Step into the room. I hand my sticker to the examiner, sanitize my hands. Hi, good morning. My name is Dr. Precious. I'm the doctor who will be attending to you in the clinic today. Are you Ethan Roberts?
Yes, doctor, this is Ethan Roberts.
Can you please confirm your age?
I'm 15.
Okay. And how would you like me to address you today?
Doctor, would it be okay if you call me Emma?
Sure, no problem, Emma. I understand you have some concerns that you want to discuss with me today, right?
Yes, yes, doctor. Yeah.
Yeah. So what can I do for you, Emma?
Doctor, like I don't know how to talk about this.
Hmm.
Yeah, I'm a bit
Okay.
nervous.
I understand. It can be nerve-wracking coming to a doctor, but let me just say that whatever we discuss is going to be between us. It's confidential, except
Mhm.
I'm concerned about your safety or I'm required by law to share that information. This is a safe place. You can tell me whatever you want, and it will not be discussed with anybody. Start wherever you're comfortable. and take your time. I'm here to help you as best as I can, okay?
Thank you so much, doctor, for the reassurance. Actually, doctor, I have a feeling that maybe I'm a girl um who's just trapped in the body of a boy, and I don't know how to disclose this thing to my parents. I'm really worried about that. That's why I'm here. This thought is really disturbing me a lot. So I don't know
Okay,
what to do about it.
all right. You've done a good thing coming here today. So, in the next few minutes, I'll just ask you some questions and address your concerns and see how I can help you the best way that I can, okay? So,
Thank you,
Emma,
doctor.
how long have you been feeling this way?
Doctor, I feel it was always like this. Maybe when I was around 5 or 6 year old. Since then, that is the last memory that I can have. But I've always felt that way. It's not something that I've started experiencing now, but now I feel it's getting more intense, I would say.
Okay. And when you say you feel like you're in the wrong body, can you just give me some examples?
Yeah, I'm never attracted towards the clothes that boys wear, and all my friends who are boys who are around me, they talk about stuff that boys are attracted to, like cars and different types of shoes and basketball players and all those things. But
Hmm.
for me, I feel I'm more attracted towards makeup, and I like to enjoy those things more.
Okay, I see. And how about clothes, the wearing of clothes? Do you also feel more comfortable when you wear female clothes?
Yes, but this is very distressing because I cannot wear them in front of my parents, as I'm
Mhm.
scared
Yeah,
to let them know about this. Yeah.
I can imagine. And then in terms of attraction, are you attracted to females or to males?
Actually, I'm attracted towards males.
Okay, I see. All right. And have you ever tried to tell your family about this?
No, doctor, I'm really scared that I don't know how they will react to this.
Okay. Do you feel safe at home? I have to ask that question.
Well, I do feel safe, but I don't know how things would be when I tell them.
Okay. But I would imagine that they have certain reactions when they see you playing with the things that are not conventionally what males are attracted to. So in those situations where you don't act the way they expect the male to act, how do they react?
They just tell me, that when will you grow out of this thing and, be a man, act like a man, things like that. They just think that maybe it's just a phase that is there.
Hmm, okay. But I have to ask though, have they ever done anything like physically hurt you or punish you or verbally
Um,
used strong words against you?
no, not so far.
Okay, all right. You're doing well so far. I just have a few more questions. Okay.
Mhm.
How about at school? How are you doing?
Well, no one knows about me in school as well. I just don't know how to, take the social pressure and tell everyone about it.
Hmm.
But I really want to do that because I'm 15 years old now, and um, I just keep on hearing these things that there are hormonal treatments available that can help stop my body from turning into a male body and help me be a female body. So I just want to address all those things, doctor. I really don't know how to tell everyone about this.
Okay. Um, sorry about that. We'll talk about all of that in a few minutes. Okay,
Mhm.
just a few more questions. Um, academically, how is your performance at school?
These days it's not that good because I'm so upset and I have lost my focus. I'm always thinking about this thing that with every passing day, I'm just turning into a more male body.
Hmm. Okay, and is that causing distress to you? The changes that you're noticing in your body that are
Yes.
male changes?
Yes.
Okay, and what changes have you noticed so far?
Like I'm growing the male pattern hair. That is
Mm,
something I'm really worried about. I've started having some mustache and beard as well. So yeah,
all right, all right. And have you faced any form of bullying at school too?
no, not yet.
Okay, all right. So just some quick questions about your social history. I need to ask. Um, are you sexually active?
Yes, doctor.
Okay, with who?
I have a friend with that friend.
I'm sorry, I didn't get the last part.
I have a friend with that friend.
Oh, okay, all right. And is the friend male or female?
Um, it's a male.
Okay. And do you use protection?
Um, Not really, doctor. And plus, my friend, this is another concern that I have because he thinks that I'm a gay, and I don't know how he will react when I tell him that I actually want to transform myself. So this is another,
Okay.
and I don't want to lose him. Yeah.
So your friend is not aware about these feelings that you have either.
No.
Okay. Um, any use of alcohol, or do you use alcohol?
No.
Okay. How about smoking? Do you smoke tobacco or cigarettes in any form?
No.
All right. And do you use any recreational drugs?
No.
Okay. Are you being managed for any medical conditions?
No.
Okay. Do you have any allergies to food or drugs?
No.
Okay. And what grade are you in school?
I'm in grade 10th, about to go to grade 11,
Okay. Who do you stay with?
with my parents.
Okay, all right. Um, so can I ask what your expectations are from today's visits, your concerns and your expectations are from today's clinic visit?
I just want to know what are my options, what I can do, how I can manage all this. How can I tell my parents? Like there are so many things that I want to
Okay, all
know.
right. So like I've said earlier, thank you very much. You're so brave coming to see us today, coming to see me today for this concern. And the first thing I want to say is for your family, when you feel you don't know how to approach them about the situation, I am
Mhm.
always available for us to have a family meeting. I can arrange that with your mom and dad, and we can tell them together, okay? In a safe place, in a safe environment. And if they have any questions, they can also ask me also. All right?
Doctor, what is this feeling that I am having? Like, why
Yeah.
am I having this?
Yeah, I'm coming to that right now. Have you ever heard of the term gender dysphoria?
No.
Okay. Gender dysphoria, that is what I believe you're experiencing. It's where where someone doesn't feel the same as the gender that they were assigned at birth. You know, when we're born, we are either male or female, but as we grow up, we all experience gender differently, and some people feel that they are more feminine, even though they were assigned the sex of males at birth. Okay, do you understand that concept so far?
Yeah.
Yeah, it happens as we grow up to some people, and it's a source of distress, just like you rightly talked about. May I ask, how has your mood been recently?
Well, it's not the best, because I'm just so worried about all this.
Hmm. And how about sleep?
It is also, disturbed. I just cannot sleep with this thought that how will I disclose this thing?
Okay, my time is up. Do I still continue?
Yes, please continue. Yeah.
Okay, sorry. And do you still find pleasure in doing activities that you usually enjoy? your hobbies?
Um, no, I like, I just don't feel like going out anymore. Yeah.
Okay, all right. Okay. So, like I was saying, it's gender dysphoria. Have you ever had any thoughts of harming yourself?
No.
Okay, all right. So, gender dysphoria is, like I said earlier, when we don't feel there's a disparity between the gender we were assigned at birth and the
Mm-hmm.
gender that we relate to. So someone who is biologically a male may feel more comfortable doing being a female in the way we dress, the activities, and also in attraction to the opposite sex. Um, there are a lot of options in terms of treatment, like you rightly said, when you don't when the changes, the physiologic changes that occur with puberty, when we're maturing, if you don't want that, we can give you certain hormones to suppress those features. And then there's also the aspect of psychotherapy. You need to talk to someone, uh, because I am worried about the symptoms where you say you don't have energy, you are worried, you're not sleeping well. Those are making me think that you might be depressed. I need you to see someone who you will talk to about this. Do you understand what I'm saying so far?
Yes, okay, yeah.
Okay. Do you have any questions?
It's just that I just don't want my parents to know about it. And is that okay? Like, can we do all this without letting them know?
Sure, definitely. Like I said, this is a safe place, and whatever we talk about is confidential. But anywhere along the line, if you feel that you need or you want to talk to them, I'm available to arrange a meeting where we can talk to them together. And then there are also support groups that I can refer you to where you can interact with other teenagers and people who are having a this similar condition as you, this feeling, where you can talk about it. I will also give you some pamphlets with information about gender dysphoria. And then we'll arrange a follow-up in the next few weeks so we can talk about our options. Is that okay?
Yes, doctor, that's fine. Thank you.
Thank you very much. Is there anything else I can do for you?
No, doctor, thank you. I'll get back to you.
All right. Thank you. Thank you. Oh my God, that was horrible.
Okay, so let me close the timer first and then we will discuss this. So, overall, Precious, you did a good job. You have this natural style of talking very comfortably to the patient and making the patient comfortable as well. So, that is a very big plus point. And in Nagoski, you score a lot of marks if you have this natural style of keeping yourself calm and talking calmly to the patient and addressing the concerns. There are a few technicalities that I would like to, focus on, because other than communication skills, we also need to focus on some other aspects which are being tested on the station. So
Mm,
let's start from the first thing, which is when you started the encounter and the patient mentioned their name, that my name is, can you call me Emma? I would suggest that if in exam this happens, please write that in on the corner of your notebook. Whatever name the patient tells you, regardless of this, that they change the name later on or whatever the name in the encounter is, because later on in the encounter you were continuously calling me Ilya. So if you change the name that the patient tells you in the encounter, and you, instead of Emma, you were calling me Ilya in the encounter later
oh,
on.
really?
So
Sorry. I thought
yeah,
it was
yeah. So that is a very big red flag. Okay, we cannot do that because name is a very sensitive issue. Even if
Mm,
you're not sure that how to pronounce the name, you can even ask the SP that, how would you like me to pronounce, or how can you pronounce your name for me, just for clarification, because name is a very sensitive thing. You have to
okay.
make sure that you are pronouncing it correctly. The other thing is the mood questions came very late in the history. In this station, the mood question is something that should have been the beginning. The moment patient mentioned that, I don't want to disclose this or whatever, you ruled out safety, that are you feeling safe at home? That was the good question that you asked over there, and you asked about the way the parents have been reacting. In every station start with OCD, onset, course duration, that since when did you started having those feelings? And you mentioned that since then, are those feelings continuous, or do you feel in certain times of in your life, did you ever felt that those feelings were just temporary and they went off? No, doctor, they were always there, they have always been there. Then ask the patient about the safety, that do you feel safe? Then the self-harming thoughts, of course. And then a mood history. Mood is very important, so ask it right in the beginning of the station. The other thing that I really wanted to discuss in the class today was, and the reason we had a 15-year-old boy was that we needed to have a very thorough sexual history. The reason is when the patient said that, yes, I'm sexually active, you said with whom, and the patient said that, it's a male friend. You need to ask that, okay, what is the age of the partner? Because what the from ethical perspective, when do we have to report child abuse or sexual abuse, in what age groups?
Between 12 and 13, the age should not be more than 2 years, and it has to be non-exploitative. And then
Yeah.
between 14 and 15, not more than 5 years, also non-exploitatory. Then
Yes.
18 for commercial prostitute,
18 is for
commercial sex and
exploitative.
other exploitative
Hmm.
sexual acts. Yeah.
Yes.
Yeah, so the 14 to 16 age group, you always have to rule out the age of the partner, and you have to ask about, how is he related to the partner. So these two important questions were missing. What if the child was being abused? The child was being sexually abused. Then a little bit of detailed sexual history is required. That if he said that, I have a male partner and he thinks that I'm gay, then you need to ask that, okay, what is your, you said their sexual preference is a male, then what kind of sexual activities do you involve in? Oral, anal, a little bit of detail, and then protection, of course. So you did ask about protection, but you have to ask about, all those things which are, and then how because the patient lives with parents, so you have to ask that, where do you where do you meet this friend? Because the patient might tell you that, it's a bar where I go, and you don't know where the patient is, involved, and if he's being abused or not. So some important questions when it is this age group. Because if it's a case of abuse, then as a doctor, you will be, in the management, you will be mentioning to the patient that, I have to report this, because this is sexual abuse, and this is something that you're being exploited. The other thing is that, yes, follow up very nicely. You did the follow up with the patient, that yes, patient has to follow up with you. You have to make sure, but there is another thing which you have to make sure that you use that in every case scenario, and that is safety networking. What is safety networking? When to tell the patient to return to the ER or to the clinic or to the hospital. So in this case, what would be your safety networking?
Mm,
When will you tell the patient when to come back to you, or to go to the emergency department?
Thoughts
Maybe
of harming?
when they have thoughts of harming themselves, or
Yes, it's
they also they are being abused at home by their family. They don't feel safe
yes.
at home anymore.
Yes, so you have to tell the patient that, I will let you go today, and I would like to set up a follow-up in 1 week. But if you ever feel that you are not safe at home or at any other place, or you feel that your safety is being compromised, you have any self-harming thoughts, or if you have any thoughts of harming someone else, please come back immediately to the emergency department. And if yes, so Anna, for the suicidal idea, if the patient has said that I'm not suicidal, because she asked the question that, do you have any self-harming thoughts? And the patient said that no. So then you don't have to screen any further. You can just, let it go. Okay, there are some other things in the chat box. Let me get back there. Okay, so also doctor asked if the friend is male or female. This negates non-binary people, and they didn't mention that some people with gender dysphoria, um, sorry, don't feel like either male or female. Yes. So this is also a point that should be noticed. And is age of consent for
Yeah.
sexual activity 16 or 18? So age of consent for sexual activity. So the age of consent for sexual activity for anyone who's like 13 plus is with consent, they can have the sexual activity. The things that we have to look for is that from age 12 to 14, the 2 years, 12 to 14 years, or you can say 13 14 years, the age of the partner should not be more than 2 years, like not more than 2 year difference. And the other thing is that that person should not be in a power of position, for example, like a coach, a teacher, power of authority, that should not be there. And from 14 to 16, the age difference can be up to 5 years. But once again, the other partner should not be in the position of authority. And above that, if they're being abused, or if they are in any, they're being pushed into some professions which are compromising their safety, or which are exploiting them, then that is something that we have to address. But till 16 years, under 12, we always report. If it's a case of sexual abuse, you will always report it. If it is between these age groups, then you have to remember this criteria. Okay, any questions before we move forward? Yes, Precious, you raised your hand.
Yes. Sorry, can you please tell me how I could have managed my time better? Because I
Yes, so
spent a lot more than 11 minutes.
yes, so I'm coming to that. So the thing is that when you started off the station, if you have this fixed pattern, that you ask the patient the mood questions. After ruling out mood, you quickly ask about. You can omit allergies and all those things in this scenario. Even if you don't ask them, that's fine. What is important is any ongoing medical condition. Number one, number two. Because in counseling cases, you need a brief history. So ask about any ongoing medical conditions, rule out safety, quick MOPS history, which is your mood, any anxiety, and then heads history, because the patient's 15. So a quick heads history. In the heads history, more emphasis on the sexual history if the patient is sexually active. And I deliberately brought this sexually active thing because I wanted to discuss this 15-year and 16-year-old thing. But in exam, you might get a patient who is not sexually active yet. So they are testing one thing: either you are looking at the sexual aspect or not, or are you a safe doctor in that sense, or can you address this. So in exam, they might give you just one thing. They might even not give you a sexually um, active patient. So the reason I gave you sexual activity was because I wanted to discuss this thing of 15-16 year old. So other than that, you can omit allergies. You can just ask about ongoing medical conditions, quick mood history, suicidal ideation, abuse, and of course heads history. And then you should be able to start your counseling. So for the counseling, let me go forward. So after the history is done, you proceed towards counseling. And for every counseling station, always remember that we tell the patient what the condition is, and then we have to check back. Yes, I will be posting my uh, YouTube channel just in a while after completing the session. I will put it in the chat box. YouTube channel and Telegram channel, both of them. Okay, so you will tell the patient that whatever we have discussed so far. Emma, I think you are what you are describing sounds like gender dysphoria, which means feeling uncomfortable. You did that very well. You explained that. The patient might ask you, "Am I weird or am I different?" So many people experience this, and you're not alone. What is important is that we support you in a way that makes you feel safe and respected. I just don't know what to do next. So that's okay, and we'll figure it out together. The most important thing is making sure that you have support for your mental and emotional well being. I understand that you don't want your parents to know right now. In Canada, medical confidentiality law allows you, like teenagers, to make decisions about their own healthcare if they're mature enough to understand the risks and benefits. So this statement is very important when you are telling the patient that you will not be involving the parents. That they are able to understand, because we know that we are always looking for the people, we call it, the term is the individuals with capacity. They are the mature ones. So and there is a criteria that they're working, they're supporting themselves, and all those things. So enough to understand the risks and benefits. That means I will keep this private unless I'm worried about your safety. This is very important that you have to mention. So you won't tell my parents, not unless there is a serious safety concern. But if you ever want to talk to them about this, I can help you guide through that conversation whenever you are ready. So this is empowering your patient and reassuring the patient that, I'm there for you, and whenever you are ready, we'll be doing that unless it's a safety concern. Then psychological support and gender affirming care. How would you address that? So would you be open to speaking up with a counselor or a therapist who specializes in gender identity? It can help provide guidance and support. Maybe as long as they don't tell my parents, that what the patient can tell you. I can refer you to a confidential gender affirming counselor. They can help explore your feelings in a safe space. Some people explore different options like social transitions, that is, they change their names and pronouns, and later, if they choose, they can discuss medical options like puberty blockers with a doctor as well. There is no rush. You are in control of this process. So when the child says that I want to go for hormonal therapies, and my friends are telling me that I can go that, this is something which has a very broader impact on the child. What later in life, when he or she turns 20, and they just say that, oh, I never wanted that, and I don't want these hormones anymore. So in NAC-OSCE, always remember, whenever there is any scenario, for example, tubal ligation, or this, or for example, prophylactic mastectomy that someone wants for after they have been diagnosed, someone in their family has been diagnosed with positive BRCA1 BRCA2 genes, and they are worried and they want to go for prophylactic mastectomy, like anything which has a very long term effect and which is hardly reversible. Always tell the patient in NAC-OSCE, always tell the patient that, take your time, there is no rush, we can talk about this later, I want you to sleep on it, I want you to think about it more. So you always leave it open ended, you never close that conversation. So you will tell them that, we can go for social transitions like changing, and this is how, because the patient was asking you how to tell everyone, how can I tell my parents, how can I tell my colleagues. To tell the patient that people explore different options, such as social transitions like changing name and pronouns. And after that, sorry, I have to admit someone. Okay. So, like changing names and pronouns. Then later, if they choose, they can discuss medical options like puberty blockers with a doctor. There is no rush, and you are in control of the process. I don't know what I want yet. The child might tell that to you. That's okay. The most important thing is that you feel safe and supported as we figure all this out. And then you can, for referrals, you can always address that, I can refer you for LGBTQ and support groups and gender affirming resources. I will be handing them over to you. Confidential counseling services for gender identity, regular follow-up appointments for mental health support. So I want to check with you again in a few weeks to see how you're feeling. You don't have to go through this alone. And then I just want you to be feel supported in all those things. So this is how you will counsel this patient. It will take, this counseling might take 3 to 4 minutes. If you are, of course, if you're going very slow pace, according to the mood of the patient. So, other than that, if the sexual history is brought in, then maybe the agenda of the station is just to see your knowledge on, so if you will ask just one question, that what is the age of the partner, it might be the same age, or, maybe it's a safe relationship that the child is having. So they just want to see that if you're asking those questions or not. So you have to ask about age of the partner, and how they are related to each other. Okay. All right. So any questions before we move? I have
Excuse me,
some.
Dr. Stan, I have a question.
Yes, yes, please.
I think I'm not sure the percentage of the people that change their mind in the future, especially in the adolescence. Can we talk
Mhm.
about with this patient about this, for example, because the patient is an adolescent and sometimes is not a permanent idea in the adolescence about their gender.
Usually, of course, they will not change. Like in real life scenarios, and whatever we see in daily practice as physicians, usually they don't. They are not willing to change, and they don't change. That is something which is there. But when it comes to NAC-OSCE, in such scenarios, for a safer for you, it is always safe thing to leave these things open ended. So don't say that you might change your mind in future. You're not saying that to the patient. You're not telling them that no, you will change your mind, because that is a kind of a judgmental sentence. But the way you are talking to the patient, it will give them the idea that you want to leave it open ended. So you will tell the patient, you're not telling them that, I don't want to do that. So you are just telling the patient to take it slow, that okay, let's start from social transitions. Some people try that. I can arrange a family meeting with you whenever you're ready. We can try social transitions, and then after that, I can refer you to a counselor and to an endocrinologist to talk further about this. There are hormones available, puberty blockers are there. So there are a lot of options that you have over there, but I will have to refer you for that. So you are not telling the patient, something like, for example, if even not just in this case, but in other cases as well, if you get a patient who's there for mastectomy, who wants to go for prophylactic mastectomy or tubal ligation, always tell them that, okay, we can discuss this further. This is all the information, provide all the information, pros and cons and everything. And then from there, tell them to, we can discuss it later.
Thank you so much,
I
Dr.
hope I was able to answer your question. Okay, so
Great,
we have
thank you.
a few questions in the chat box. If we suspect sexual abuse, is it okay to inform also the child that we have to report? Oh yes, in NAC OSCE you have to inform whatever thing is reportable, not just sexual and child abuse. If even if it's, for example, an epileptic patient, and you have to report it to the Ministry of Transportation, because they won't be able to drive till they are fit free for 6 months to 1 year. You have to tell the patient that I have to report it. So in NACOSCI, because they are testing you for that, so you have to mention that. Even if it's a parent with the child, you have to tell them that this is I think this is called child abuse, and I have to report it to the services. So you have to tell whatever you have to report. Similarly, for reportable diseases, all the reportable diseases, you have to tell the patient that I have to report the infectious disease control and everything. Okay, we have some more questions in the chat. Um, how ask about feeling of male characteristics. So to ask about male and female characteristics, the way Precious asked that, what attracts you more, what are you attracted towards more. So that will give you an idea. You don't have to explore a lot on that, because the station wants you to discuss, to counsel the patient. So don't explore a lot into that. Like one or two questions, that what attracts you towards male or female, things, the way Precious asked. So those questions are okay. And can we go back to the initial history taking slide once done? Yeah, sure. So initial history taking, I did not write initial history taking because history, I started it from the counseling. So history is something that I did not put here. So history, you will have to, it's not in the slides. I just gave the material for this. And history, of course, OCD. And after that, when did it start? Since when are you having those feelings? And are these feelings continuous or not? And then mood questions, anxiety questions, and then a brief, ongoing medical condition that you have. After that, head's history, because the patient is 15 years old. So this is how we will be addressing it. Okay, any more questions? Can we ask for HPV vaccine? So, the thing is that you have to see what is the agenda. Okay, what is the agenda of the station? So in this station, what they want you to do is they want you to discuss and counsel the patient, and they want to see that how you will approach such a case. Okay, you will not be judging the patient. So asking HPV question would be important if you are having a patient with something for example, in female patients, if you're getting somewhere with an abnormal pap smear, or sexually transmitted infections and all those things, then it is important. If you have time, you can bring that question in the end. If you have time after everything, so you can just say, okay, Emma, just one last thing, because you mentioned that you are sexually active, and I just want to make sure that you are safe. I just want to know that, did you ever get vaccinated in school with HPV vaccine? So you can ask that question there. And but if it is just a simple, if it's the patient does give you sexual abuse history, do ask HPV. It won't take a lot of time, just a few seconds. And if it's in the checklist of the examiner, you will get the marks. Yeah. So if you say I have to report, and the child says no, you will ruin my relationship, how can you respond politely? Yeah, so you have to tell the patient that the goal is not to ruin your relationship. The goal is to make sure that you are safe. So that's why it's a part of my duty that I have to report this. And as far as you're concerned about ruining your relationship with your parents, or ruining your relationship with if it's regarding, I think your question is regarding the partner. So yeah, if the child says that it will ruin my relationship with my partner, so you have to tell the child that the goal is not to ruin your relationship, but the goal is to address this thing so that you feel safe and you are not being exploited. Because having a partner who's, for example, if the partner is in position of authority, so just tell him that, for example, if your partner is there and he's in the position of authority, it's not just the sexual abuse that is there, but there are other things that will affect your mental well-being as well. So as your physician, I'm concerned, and you still fall into that age group where this thing is reported, because I don't want any further exploitation for you, so I have to report it. So you just tackle it in a very political way and very amicably. This is how you will tell them. Of course, they will, even if you will tell a simple epileptic patient that I'm going to report it to Ministry of Transportation, and you won't be driving, the patient will show some reaction. So you should know how to deal with that reaction. That is the whole purpose of NAC OSCE. They want to see that how you will address and calm down the patient. Okay, any other questions before we move forward? Okay. So this was the case of gender dysphoria. This case can also come as a mother, you who can just come to you in pediatrics, who can come and who can ask you that, I have a child, and my child is having this, he's acting like this. So in that you will have to ask some questions to the mother about the mood of the child, and what things the child is attracted to, and you will ask about the reaction of the parents towards this, that how are you coping up with this, what is your reaction to this. And depending on the age of the child, then it can be your grades, and all the history, that is the pediatric history, that is, so it can come like that as well. Okay. So this was a case of gender dysphoria. Now, this is a NAC crash course that I'm offering for the people who are appearing in May. We have 8 classes, and the cost is $250, and the plan is to do 12 high yield cases in each class. So it would be a total of 96 high yield cases that we will be going through. And I have very limited spots for this, because I want everyone, like all my students, usually in my regular sessions also, I don't take more than 12 to 14 students, because it affects the overall performance. So if any one of you is interested to join it, we will be starting it from April 8th, and it will go all the way to April 23rd. Other than that, I was offering mock as well, but mock is quite full now. But if any one of you still wants to go ahead with the mock exam, you can let me know. But overall, the mock is quite full right now. These are the planned dates for if any one of you is appearing in September. So in September, I'll be starting my next session in May. I have, finished my one batch. So for those of you who want the mock exam, you can send me a message on my Telegram. I will send you the dates which are available, and I'm offering 10 cases for $100, and 50 cases for 5 cases for $50, whatever your preferences, how many cases you want to take, I will let you know. This is the detail of the next session that I'll be starting. So if any one of you wants to join, who's appearing in September, they can join the classes in May. So I don't know what happened with my Zoom. Okay. Anyways, so I will just be sharing the link of my Telegram channel here. Just give me a minute. Any other questions that you guys have so far, you can let me know about that. So, sorry. I'm posting the Telegram link here, and you can join the Telegram link. And on the Telegram link, I will be posting this today's video as well. And I will also be posting the YouTube channel's link also. I don't know why my presentation just stopped. Okay, any questions, guys, before we finish the session? If you have any questions, concerns, anything related to NAC OSCE, you can ask me. Yes, sure. Whoever So whoever wants to take it later on, you can take it later on as well, not a problem. If you have any questions, you can always ask me. Just let me see if I can uh, bring that slide in once again because my screen just stopped. So you will be taking your exam in September. Sorry, which exam, Anna? Which exam? Sorry. Are you taking QE1 or NAC? So your NAC exam is in September? Yeah, of course. If you when are you giving your QE1? If you are done with QE1 like in April, you can easily prepare till September. So it's not going to be and it won't be a problem for you, not at all. Yeah, so these are the details of the right now. I like initially I was running two batches, but right now I have just planned one batch during the weekdays. So it will go from May to June, and timings will be 10 to 1. So this is and it will be 2 days a week, and the entire course is for 400 Canadian dollars. So if you are interested, let me know. And this is my email, medicinebyheart@gmail.com. So you can feel free to send me an email for any queries if you have. And I've already sent you the Telegram link. I will also be sharing you know, other the YouTube channel. I will be sharing on my Telegram. Okay, so this is something that I wanted to. Sorry, because I opened my Telegram, so I have all these things popping up now. So if you have any questions, let me know. Otherwise, I'll just stop the recording and we'll end the session here. Okay, so no questions. All right, so I'll just stop the recording.
Thank you,